Hello Medicose, welcome to the channel. Did you know that 4 key factors influence your heart's performance? Not just how fast it beats, but how strong, how responsive, and how quickly it sends electrical signals. Ever heard of chronotropic, inotropic, dromotropic, and bathmotropic actions? In just a few minutes, you'll understand exactly how these hidden forces keep your heart in perfect rhythm. But before understanding these effects, let's take a quick look at how your heart's rhythm is controlled. The heart's natural pacemaker, the SA node, generates electrical impulses that regulate the heartbeat. After the SA node fires, the electrical signal travels to the AV node, another crucial part of the heart's electrical system. The AV node acts like a gatekeeper, slowing the electrical signal. The delay gives the atria time to fully contract and push all the blood into the ventricles before the ventricles start their contraction. If the ventricles contracted too early, before the atria finish their job, there wouldn't be enough blood in the ventricles to pump efficiently. Now let's start with chronotropic effects. These are all about changes in your heart rate. A negative chronotropic effect decreases the heart rate by reducing the firing rate of the heart's natural pacemaker, the SA node. On the other hand, a positive chronotropic effect speeds up the heart rate by increasing the firing rate of the SA node. So, what can cause changes in heart rate, also known as chronotropic effects? A variety of factors can influence whether your heart beats faster or slower. First, let's talk about factors that cause a positive chronotropic effect, increasing heart rate. These include sympathetic nervous system stimulation. When you're under stress, exercise, or excitement, your body releases adrenaline, which speeds up the heart rate. Medications. Certain drugs like atropine or epinephrine stimulate the heart to beat faster. Thyroid hormones can also increase the heart rate. On the flip side, factors that cause a negative chronotropic effect slow down the heart rate. These include parasympathetic nervous system stimulation. During rest or relaxation, activates the vagus nerve, which slows the heart rate. Drugs like beta blockers or calcium channel blockers decrease the heart rate by reducing the effects of adrenaline or blocking calcium influx. Hypothyroidism or diseases that affect the heart's electrical system like heart block can also lower heart rate. Your heart rate is constantly being influenced by the balance between the sympathetic and parasympathetic nervous systems, as well as medications and hormones to keep your body functioning efficiently. Now that we've covered chronotropic effects, let's dive into dromotropic effects. These refer to the speed at which electrical impulses are conducted through the heart's conduction system. Don't confuse heart rate with conduction speed. These are two separate functions. Heart rate is a function of the SA node, the heart's pacemaker. Chronotropic effects either speed up or slow down how often the heart beats. Conduction speed, however, is controlled by the AV node. Think of the AV node as the heart's relay station. It delays the signal coming from the atria before it reaches the ventricles. So, dromotropic effects regulate how quickly or slowly the ventricles contract after the atria. A positive dromotropic effect shortens the delay, while a negative dromotropic effect lengthens it. When you're excited or scared, your body releases adrenaline. This hormone acts like a shot of espresso for your heart, making it beat faster. A negative dromotropic effect slows down conduction through the AV node, which lengthens the PR interval. A positive dromotropic effect speeds up conduction through the AV node, shortening the PR interval and allowing the ventricles to contract more quickly after the atria. As you know, the PR interval represents the time it takes for the electrical impulse to travel from the SA node in the atria, through the AV node, and to the ventricles. Let's talk about factors that cause a positive dromotropic effect. Sympathetic nervous system activation causes a positive dromotropic effect. When you're under stress or exercising, the body releases adrenaline, which enhances conduction speed. Medications, certain drugs like isoproterenol, stimulate the heart and increase conduction through the AV node. The factors that cause a positive dromotropic effect are parasympathetic nervous system activation. The vagus nerve, when stimulated, slows down conduction. This happens during rest or relaxation. Medications. Drugs like calcium channel blockers and beta blockers reduce conduction speed, often used to manage conditions like atrial fibrillation. Heart conditions. Issues such as heart block or ischemia can also impair conduction through the AV node. Next up are inotropic actions. Inotropic effects refer to the changes in the strength or force of the heart's contractions. These effects can be classified as either positive or negative. A positive inotropic effect increases the force of contraction of the heart muscle, leading to more effective pumping of blood. This is crucial during situations like exercise or stress, where the body requires increased blood flow. Sympathetic nervous system activation can cause positive inotropic effect. When the body is under stress or during physical activity, the sympathetic nervous system releases norepinephrine and epinephrine. These hormones bind to beta-1 adrenergic receptors on heart muscle cells. This binding increases the influx of calcium ions into the cells, can cause a positive ionotropic effect. Calcium plays a crucial role in the contraction process, as more calcium leads to stronger contractions. It increases the strength of each contraction, making the heart a more efficient pump. Medications like digoxin increase the force of heart contractions by inhibiting the sodium-potassium pump, leading to higher intracellular sodium levels. This in turn promotes calcium retention inside the cells. A negative inotropic effect decreases the force of contraction. Medications like beta blockers can reduce contractility. Heart conditions. Issues like ischemia or cardiomyopathy can weaken heart muscle function. Now let's see what is Bathmotropic effect. It refers to changes in the heart's excitability or its ability to respond to stimuli. This plays a crucial role in the heart's overall function. Bathmotropic actions influence how easily the heart fires or contracts. A positive bathmotropic effect increases the excitability of cardiac muscle cells, making them more responsive to electrical impulses. Stimulation from the sympathetic nervous system increases excitability, allowing the heart to respond more readily to incoming signals during stress or exercise. A negative bathmotropic effect decreases excitability, making heart cells less responsive to stimuli. When the parasympathetic system is activated, such as during rest, it can reduce the heart's excitability, leading to decreased responsiveness to electrical impulses. Electrolyte imbalances like high potassium levels or hyperkalemia can decrease the heart's excitability, making it less likely to beat. These actions allow the heart to adapt to the body's ever-changing needs, whether it's during exercise, stress, or even rest.